Philip was 58 years old, taking finasteride for hair loss. Had been on it for 5 years. Worked great. Hair looked good. Annual PSA test came back. 3.2 ng per ml. His doctor. That's excellent. Normal range. Philip felt good about the result. Next year, PSA 3.4. Still good. Year after, PSA 3.6. Still normal. His doctor never asked, "Are you taking any medications?" Philip never mentioned the finasteride. Didn't seem relevant to prostate test. Year 4. PSA jumped to 4.8. His doctor was mildly concerned. "Let's watch this. Might just be benign enlargement." 6 months later, PSA 5.2. "Let's continue monitoring." Philip still didn't mention finasteride. His doctor still didn't ask. Another 6 months, PSA 6.1. Now concerning. Additional testing ordered. Prostate MRI showed suspicious lesion. Biopsy performed. Cancer found. Gleason 4+3. Grade group 3. More aggressive than expected for PSA of 6.1. Treatment started immediately. Oncologist reviewing his case asked routine question.
"What medications are you taking?" Philip listed everything including finasteride. Oncologist stopped. "You've been on finasteride this whole time?" "Yes, 5 years, for hair loss." Oncologist looked at his PSA history, did quick calculation. Finasteride cuts PSA in half. Your PSA of 3.2 wasn't actually 3.2? It was probably 6.4. Your 3.6 was probably 7.2. Your 6.1 was probably 12.2. You've had significantly elevated PSA for years, but the finasteride masked it, made everything look normal when it wasn't. Philip was shocked. "My doctor never asked about medications. I never knew finasteride affected PSA. I thought I was fine for years." Oncologist explained. Finasteride lowers PSA by about 50%. When interpreting PSA in men on finasteride, doctors should double the measured result. Your doctor didn't know you were taking it. You didn't know to mention it. Result: 2 years of undetected cancer progression. If we'd known about the finasteride, your PSA of 3.6 would have been interpreted as 7.2. Would have triggered investigation much earlier. Potentially caught cancer at earlier stage. Philip's cancer was treatable but more advanced than it should have been, all because one medication wasn't communicated. His doctor didn't ask. Philip didn't know it mattered. The finasteride that helped his hair hid his cancer. Today, I'm revealing the medications that dangerously alter PSA results, how each one affects your numbers, and why telling your doctor about every medication could save your life. If you take any daily medications and get PSA testing, this information could prevent what happened to Philip. This video is for education only, not medical advice. Never start or stop medications without consulting your doctor. This is about medication disclosure for accurate PSA interpretation. Individual situations vary. Before we start, comment medications below. I'll send you the complete medication effects guide. Takes 2 seconds. Now let me show you the 5 most dangerous medication categories for PSA testing. Medication 1. Finasteride, the cancer masker. This is what Philip was taking. Brand names: Propecia for hair loss, Proscar for enlarged prostate, Propecia, 1 mg daily for male pattern baldness, Proscar, 5 mg daily for benign prostatic hyperplasia. Both contain same drug, finasteride. How finasteride works: blocks enzyme that converts testosterone to DHT. DHT causes hair loss. DHT also stimulates prostate growth. Blocking DHT helps hair. Also shrinks prostate. But here's the critical danger for PSA testing. Finasteride reduces PSA by approximately 50%. Not 10%. Not 20%. 50%. Your PSA gets cut in half. The effect starts within first few months of treatment, reaches maximum suppression by 6 to 12 months. Stays suppressed as long as you take the medication. Philip's oncologist showed him the math. Measured PSA 3.2 on finasteride equals actual PSA around 6.4. Measured PSA 3.6 equals actual PSA around 7.2. Measured PSA 6.1 equals actual PSA around 12.2. At actual PSA of 7.2, investigation should have started immediately. Instead, measured PSA of 3.6 looked completely normal. 2 years of cancer growth went undetected. Why this happens so often? Men see dermatologist for hair loss prescription. Dermatologist prescribes finasteride. Man takes it faithfully for years. Primary care doctor orders annual PSA, but doesn't know about dermatology medications. Patient doesn't think hair medication relates to prostate test. PSA comes back looking great, actually suppressed by medication. Real-world example from Philip's oncologist. I see this pattern 3 to 4 times per year. Man in 50s taking finasteride for hair. PSA looks normal for years, then jumps suddenly when it breaks through suppression. By then, cancer has been growing undetected. Could have been caught years earlier if we'd known about finasteride. Critical action. If you take finasteride, tell every doctor, especially whoever orders your PSA. Write it on every medical form. Mention it before every PSA test, even if previously disclosed. Understand your measured PSA must be doubled for accurate interpretation. PSA 4 on finasteride is actually PSA 8. PSA 5 on finasteride is actually PSA 10. This isn't optional math, it's life-saving calculation. Medication 2, Dutasteride, finasteride's stronger cousin. Brand name Avodart, similar to finasteride but more potent. Blocks both types of enzyme that create DHT. Finasteride blocks only one type. Result, Dutasteride shrinks prostate even more than finasteride. Used primarily for severe benign prostatic hyperplasia. Sometimes prescribed off-label for hair loss. The PSA danger, even worse than finasteride. Dutasteride can reduce PSA by 50 to 60%. Some men see even greater suppression. Same doubling rule applies, but with less certainty. Measured PSA must be at least doubled, possibly more depending on individual response. Additional concern with Dutasteride. Takes longer to clear your system if you stop. Finasteride clears in weeks to months. Dutasteride can take 6 months or longer. If you stop Dutasteride and retest PSA, don't expect immediate jump back to true level. PSA will rise gradually over 6 to 12 months. During that time, interpretation remains difficult. Real patient example. Man on Dutasteride for 3 years. Measured PSA always 2.8 to 3.2. Stopped Dutasteride due to side effects. 6 months later, PSA tested at 4.9. 1 year later, PSA reached 6.8. His true baseline PSA was 6.8, not the 3.0 he'd seen for years. Fortunately, no cancer, just benign enlargement. But the medication had hidden his actual PSA level for years. Medication 3. Saw palmetto and prostate supplements. These are over-the-counter, available at any drugstore or health food store. Common brands, multiple manufacturers. Marketed for prostate health support, urinary flow improvement. Active ingredients vary. Saw palmetto berry extract, beta-sitosterol, Pygium africanum, stinging nettle root. Men take these thinking, natural is safe, won't interfere with medical tests. The reality, Herbal doesn't mean harmless to PSA testing. Saw palmetto specifically can lower PSA by 10 to 30% in some men. The problem? Effect is unpredictable. Finasteride drops PSA consistently by 50%. You can calculate. Saw palmetto? Might drop PSA 30%, might drop 10%, might not drop it at all. Depends on product formulation, dosage, individual metabolism, duration of use. This unpredictability makes PSA interpretation nearly impossible. Example, man takes saw palmetto for 2 years. PSA stays around 5.5, seems stable. Stops saw palmetto. 3 months later, PSA jumps to 7.2. Was the saw palmetto suppressing by 1.7 points? Or did prostate actually grow? No way to know. Additional supplements that may affect PSA. Beta-sitosterol, plant sterol, may lower PSA modestly. Pygium africanum, African tree bark, possible PSA reduction. Stinging nettle, root extract. Unclear PSA effects. Zinc supplements, High doses might affect PSA. The advice from Philip's oncologist: if you want clear, interpretable PSA results, avoid prostate supplements. Or at minimum, tell your doctor exactly what you're taking. Don't assume natural means doesn't count. Everything you put in your body potentially affects PSA. Medication 4. Chronic ibuprofen and NSAID use. This one surprises most people. NSAIDs, non-steroidal anti-inflammatory drugs. Common examples: ibuprofen, Advil, Motrin, naproxen, Aleve, aspirin in high doses. People take these daily for arthritis, back pain, headaches, general aches. You'd think anti-inflammatory should lower PSA, right? Inflammation raises PSA, reduce inflammation, lower PSA. But research shows chronic NSAID use can actually raise PSA in some men. The effect: modest, but measurable. Usually 0.5 to 1.5 point elevation. Why this happens? Mechanism not fully understood. Theories include NSAIDs may affect how prostate cells produce PSA, may alter prostate tissue in ways that increase PSA release. Individual genetic factors determine who's affected. Real example: man takes ibuprofen 800 milligrams twice daily for arthritis. PSA climbs from 7.2 to 8.9 over 2 years. Urologist concerned about progression. Patient switches to acetaminophen for pain management. 2 months later, PSA drops to 7.6. The ibuprofen was adding about 1 point to his PSA. Once stopped, PSA dropped back toward baseline. Important distinction: this is chronic, daily use. Taking ibuprofen occasionally for headache doesn't affect PSA. But taking it every single day for months or years can elevate PSA. If you take NSAIDs daily and your PSA is climbing, ask your doctor about trial period off NSAIDs if medically safe. Switch to acetaminophen or other pain management. Retest PSA after 2 months. If PSA drops, the NSAID was contributing to elevation. If PSA stays same, the elevation was from prostate itself. Medication 5. Testosterone replacement therapy. Increasingly common as men age. Prescribed for low testosterone levels, fatigue, decreased libido, muscle loss, forms, injections, gels, patches, pellets. Testosterone directly stimulates prostate growth. That's why testosterone replacement requires careful PSA monitoring. The effect on PSA usually increases PSA by 0.5 to 2 points, sometimes more depending on dose and individual response. This isn't necessarily dangerous, expected effect of treating low testosterone, but requires baseline PSA before starting, then monitoring every 3 to 6 months while on therapy. The danger: starting testosterone without baseline PSA, or not monitoring PSA regularly. Example: man starts testosterone gel at age 62. Feels great, more energy, better mood, but no PSA testing done before starting. No monitoring during treatment. 2 years later, routine physical, PSA tested. Result: 8.4. Is that from testosterone stimulating benign growth or from testosterone stimulating cancer growth? No baseline to compare. Additional testing needed to determine. Could have been avoided with proper monitoring. Philip's oncologist protocol for testosterone patients. PSA must be checked before starting testosterone. If elevated, investigate before initiating therapy. If normal, proceed with testosterone. Recheck PSA at 3 months. If stable or modest increase, continue monitoring every 6 months. If rapid increase more than 2 points, stop testosterone. Investigate. This ensures testosterone replacement remains safe, while catching any concerning PSA changes early. Looking back after his cancer treatment, Philip identified what would have saved him. 1. Always mention every medication to every doctor, even if medication seems unrelated to the test. Hair loss medication absolutely relates to prostate testing. 2. Don't assume your doctors share information. Philip's dermatologist prescribed finasteride. His primary doctor ordered PSA. They didn't communicate. Electronic medical records should connect everything, but doctors don't always review complete medication lists. Patient must be their own advocate. 3. If taking finasteride or dutasteride, demand PSA adjustment. Don't just accept measured PSA at face value. Ask, should my PSA be doubled because of my medication? Make sure adjustment happens. 4. Before starting any new medication, ask about PSA effects, especially medications for hair loss, prostate health, or testosterone. One simple question: will this affect my PSA test? Philip's cancer required surgery and radiation. He's cancer-free now, but treatment was more aggressive than if caught earlier. Side effects were worse. Recovery took longer. All because finasteride masked his PSA for 2 years. He now advocates loudly, tell your doctor everything you take. Everything. Prescription medications from any specialist. Over-the-counter medications taken regularly. Supplements and vitamins, especially anything marketed for prostate health or hair loss. The medications that affect PSA most dangerously: finasteride, cuts PSA in half, must double measured result. Dutasteride, cuts PSA 50 to 60%, must double or more. Saw palmetto, unpredictable 10 to 30% reduction. NSAIDs, can raise PSA 0.5 to 1.5 points with chronic use. Testosterone, usually raises PSA 0.5 to 2 points. One undisclosed medication can make the difference between early cancer detection and delayed diagnosis, between simple treatment and aggressive intervention, between better outcomes and worse outcomes. Comment medications below for the complete medication effects guide with adjustment protocols. Subscribe for next week's video on supplements specifically marketed for prostate health and their hidden effects on testing. Philip's 2-year delayed diagnosis could have been prevented. With 3 words: I take finasteride. Don't let medication's silence cost you early detection. Speak up about everything you take. Your life may depend on it.